So the benefits for robotic surgery are great for both the patient and the surgeon. So for the surgeon, we actually get to sit down to do the surgery, whereas if you're doing traditional laparoscopy, we have to stand all day at the patient's bedside. So the surgeon gets to sit, and then we look into this console to see the view of the patient that we're operating on, and that view is a 3D view. So we can actually tell the depth of one organ behind the next organ, which is pretty exciting. And then we have instruments that have basic wrists on the end of them. So when you're doing traditional laparoscopic surgery, I try to explain that to patients as doing surgery with chopsticks. So you have straight sticks that you're sticking into the patient through these little tubes called trocars, and then you're moving those sticks around to maneuver and move organs around or cut organs or whatever the task is that you need to be doing. But with robotics, when you stick those instruments in, now those instruments have 7 degrees of motion on the end, just like our hands do. So we can actually get behind things and move things in a way we've never been able to. So it's a great advantage for the surgeon to be able to get the surgery done more efficiently. And for the patient, we are finding that patients have less pain with robotic surgery. So when I'm using the chopstick laparoscopy type surgery, if I need to get to a target area or target organ, I'm going to push or use that fulcrum on the abdominal wall as much as I need to. I'm going to apply a lot of pressure to get to an organ perhaps. But with the robotic surgery, we don't have that issue because we have those degrees of motion that we're able to reach the target organ easier. And so that equates for less pressure on the abdominal wall and less pain for the patient in the long run.